Good morning, I'm Julie, the doula trainer, and a couple of doulas have been requesting extra information beyond what I've got in the book about breech. So let's take a quick look at the book, and here you'll see 3 pictures. If you've booked into the course and you've already received your training kit, open up your book to page 70 and you'll see the first one is frank breech, the next one complete, and the next one footling. Now unfortunately the complete and the footling, because of those positions, they're unable to be born normally, whereas the frank breech, because of the position of the baby, that one can be attempted. If the mum's really motivated to have a normal birth and avoid a caesarean section, or avoid the typical medical model of birthing a breech baby, which is on her back with an epidural, legs up in stirrups, the obstetrician will assist the baby out, but then do forceps for the after-coming head. So there are other options, and where the mother is keen to have a natural birth, have an active birth, what's recommended by May Gaskin in the States, in the USA, and she's a famous midwife dealing with this, is to stand up and use gravity and have more even pressure of the baby coming out, or perhaps all fours or semi-squatting. So as a doula, if you are listening very carefully to what a mother is saying about how she feels, then one of the ways that you could not diagnose, but maybe be just a fraction suspicious that her baby's breech, is that she's complaining of a lot of pressure up in her gut, under her ribs, and that's where the head would be. She's also complaining of getting kicked very strongly into her bladder, and her belly, instead of looking like a beautiful upside down pear, it would look more like a basketball or maybe a beach ball, up high and way out at the top. So that means that baby's head is up and the bottom is down. Of course, there are other positions as well, such as oblique or transverse, and they aren't breech deliveries, they're not breech babies. So with the bottom down and the head up, it does make for a more challenging birth, there's no doubt about that, but it can be done instead of having a caesarean section, especially if the mum's already birthed before and this might be her second baby. So keep that in mind, that for a doula to listen carefully to how is the mum describing this. Normally, with the head down, the woman would have quite a bit of pressure against her bladder, but not sudden kicking and severe pressure like that. She will complain of rib pain, sure, but usually more on one side than the other, and not quite so much right in the centre. So if she's getting kicked into her ribs, of course that means the head is down. Let me show you. So we've got a beautiful little baby here, hello, and this little one is known as a fetal doll. And they can be purchased from companies like birthinternational.com, based in Sydney, and they have all of these products available for childbirth educators, midwives, doulas, etc. So the baby's head is down, the baby's bottom is on one side, quite often the left, and the baby may well be kicking into mum's right rib. So that'd be a normal presentation, but what we're talking about today is breech presentation. So head up, bottom down. And the way that this baby would be born is that the bottom comes well down into the pelvis, and then the bottom comes out the vagina, and then I'll have to hold it up to show you, one leg will come down, the other leg will come down, and then the little arms are like so. The baby will move down, rotate around, one little arm out, other little arm out. The obstetrician will pop a finger in the baby's mouth from this angle and pull the head down like so, and then that will help the angle and the size of the baby's head to come out more normally. I'll take a hold of the ankles and flip the baby up that way. So that's the quickest explanation of how is a baby born when they're born by breech. I would always recommend actually to attempt to turn a baby at around about 36, 37 weeks using an ECV, which is an external cephalic version, and it means that the obstetrician will get the woman to lay down, set up a Ventolin drip. It's one of the most safe drugs that can even be used with newborn babies, and will relax the uterus using the Ventolin, and then do an ultrasound to check the lay of the baby, where exactly is the placenta, the cord, the baby, and then carefully and gently rotate the baby around to head down. Then they'll ask the mum to sit up. They'll do an ultrasound, check everything's fine, we're not squashing the cord, and then get the mum to sit up, and that will help slot the head into the pelvis. So I've oversimplified all my descriptions there just to give you a rough idea of how these things are done. What I do recommend is have a look on YouTube at Dr. Andrew Bissett's, B-I-S-S-E-T-T-S. No, B-I-S-S-I-T-T-S. Dr. Andrew Bissett's, he's a Sydney obstetrician, and I think it was unbeknownst to him, a dad filmed him doing an ECV and then uploaded it to YouTube to show everybody. So he's a very quiet, very gentle obstetrician, and you can watch him do an ECV, which was successful. The baby's head did turn and the mum went on to have a normal birth, which was great. So another thing with a breech baby is much earlier, once the baby is diagnosed as breech, then let's say 32, 33, 34 weeks, what I'd recommend is heading off to a qualified homeopath and ask for pulsatilla drops. So it's a homeopathic remedy. It's not the slightest bit evidence-based, but never mind. It's best that the doula does not purchase this remedy and give it to the mother. The mother needs to go to a qualified homeopath, and she needs to receive instructions from a qualified homeopath. Now, the doula is fine to do all of this if she's also a qualified homeopath. Otherwise, you're stepping outside your boundaries. You can advise the mum, and you can find homeopaths for her and link her up. She makes the appointment and attends. So that's actually the wise thing to do. Another thing is to book into a Chinese acupuncturist, and they can do acupressure points, or there'll be qualified massage, people who know where the acupressure points are. So the doula is not supposed to treat a woman or pretend to be a qualified person that she's not. I can point out, and I do in my course when people are face to face, I can point out exactly where those acupressure points are. However, it's not for it's for a qualified person to do, not a birth doula. So it's important to understand our boundaries, and it's important to understand when do we refer. Now, another person to refer a woman to that's carrying a breech baby is a osteopath and also a chiropractor, so they will both be able to assist the woman. So there can be a variety of reasons why a baby's presenting breech, and that's fine. And so other modalities will be able to help the woman as well. So we need to find out reasonably early so that we've got time. If the woman is 39 weeks pregnant and she finds out that the baby's breech, it can be quite challenging to try and correct things before she actually goes into labour. Interestingly, but not always, breech births are sometimes quite quick. So the dilation and the birth of the baby can actually be surprisingly fast. If it's a very slow, long breech birth, it's said something not quite right here. And so a longer birth for that is not ideal. What else can I tell you? I think pulsatilla is the remedy that helped to turn my breech baby when my second one was breech. And so that was very successful. Within 48 hours, he had turned around. So I laid in the bath, and a friend had given me some instructions. Lay in the bath, grab some oil, massage your belly, talk to your baby, and say to the baby, Mummy wants you to go head down instead of being breech. So we're going to have a much better birth, sweetheart, if you go head down. It's going to be an easier birth. So I massaged my belly. So you locate which side the head is on, if it's on the side, and then you talk to the baby. So I did the homeopathic pulsatilla drops and then massaged my belly in the bath with some oil, and that was a big help in turning the breech baby. So then we went on to go overdue by to 43 and a half weeks, and then the labour was 1.5 hours from the time I woke up saying, oh, I'm getting waves, this is it, we've started labour, to the time baby Ryan was in my arms was only 1.5 hours. So I'm very glad of that. Chat soon.